Hi, my name is Robert Gregory Field. I'm a psychologist practicing in Westport, Connecticut, New York City. Now today I'd like to talk briefly about psychodynamic psychotherapy as a treatment method for depression. Now psychotherapy, or psychodynamic therapy, is perhaps what we think of when we think of talk therapy. As psychodynamic was originally simply a word developed as a synonym for psychoanalysis, in essence, this treatment method is psychoanalytically informed. Now, what that means is that it is primarily oriented towards addressing both the underlying emotions and the meaningful and organizing aspects of personal experience, i.e., history. It's oriented towards generating insight, that is, understanding into the meanings, both emotional and cognitive, that underlie the particular disorder, here depression, and its symptoms. To this extent, the focus of cognitive behavioral therapy, the how and what we think, could also be considered part of the psychodynamic process. Now, for a variety of reasons, psychodynamic psychotherapy has become negatively viewed as an effective treatment method for depression as well as other disorders. It's not viewed generally as being an evidence-based treatment, perhaps due to its highly individual and difficult to define nature of its process. Nor has it benefited from the amount of supportive research that has occurred in relation to cognitive behavioral or medical approaches. Now, this is highly unfortunate and mistaken in regard to the effectiveness of the treatment. What is true is that psychodynamic psychotherapy is and has been shown to be highly effective in treating depression as well as other disorders, for instance, anxiety. In statistical terms, the results from a number of meta-analyses of treatment outcome studies, that is, overall analysis of the results of large groups of individual studies, comparing it with cognitive behavioral methods and/or medication treatments in relation to depression in particular, have demonstrated the largest effect sizes being those for psychodynamic psychotherapy. That's more than for either CBT or medical treatment approaches together or alone. Furthermore, not only do meta-analysis studies of psychodynamic therapy show generally the highest effect sizes, they show a consistent continuing trend in larger effect sizes at later follow-up points. And what this demonstrates is that the psychological processes being set in motion lead to ongoing change, even following completion of therapy. These goals are sought through a process of self-reflection, self-exploration, and self-discovery occurring in the context of safe, deeply authentic, and empathetic relationships between patient and therapist. Therefore, it is to be considered a viable treatment method. So that concludes this video today. Please stay tuned for other videos which I talk about other treatment approaches as well as other aspects related to depression. Thank you for listening, and please note the link to my website below has information about me, my practice, as well as contact information. Again, thank you.